Today we are going to learn larynx, which is a small passage in between the pharynx and trachea, lying in between the C3 to C6 cervical vertebrae, right? Anteriorly, you can see the sound box or larynx. There lies the thyroid cartilage, which has got two laminae and the two cornu, the superior and the inferior. And you can see the cricoid cartilage just below it. And at the very top, you can observe the epiglottis. And just below it, there lies the hyoid bone. And posteriorly, you can see that the cricoid cartilage has got lamina and is making joint with the arytenoid cartilages. And at the apex of the arytenoid cartilages, you can get the corniculate and cuneiform cartilages, right? Here you can see the green colored thyroid cartilage. This image is taken from posteriorly. Now you can see the gray color cricoid cartilage, and at its top of its lamina, the arytenoid cartilages are resting. And you can very well observe that the epiglottis has got a narrow stalk which is being attached posteriorly in between the thyroid notch, and its free upper end is also shown here. Now what we have to learn that the thyroid cartilage and the cricoid cartilage and the bases of the arytenoid cartilage, they are made up of hyaline cartilage. And at the apex of these arytenoid cartilage, let me mark them. This can be shown here, and the cuneiform and corniculate and the epiglottis, they are made up of elastic cartilages, right? Now this is the cricoid cartilage, and here you can see its anterior arch and the posterior lamina. Now what else I have to show you, that here you can see the arytenoid cartilages. It has got the vocal process and the lateral lying muscular process, and its apex is being shown to be having the corniculate and the cuneiform cartilages. Now we have to focus on the laryngeal inlet. Here what do you see? You see anteriorly the edge of the epiglottis, and laterally you find the airy epiglottic folds, right? What else we see? We see in the next picture that posterior boundary is being formed by the corniculate and cuneiform cartilages, and also the interarytenoid notch, which is present in between the two arytenoid cartilages, being shown in green color, right? And this is forming the interior, lateral and posterior boundary of the laryngeal inlet. Now focus on the intrinsic muscle of the larynx. You can see on its lateral aspect the cricothyroid, its vertical and oblique fibers. Now you have to see that the name of the muscles are given according to the attachment. Like this cricothyroid is showing that it is present in between the cricoid cartilage and the thyroid cartilage, right? Now we have to see that this is the thyrohyoid membrane, and it becomes prominent on the lateral aspect to form lateral thyrohyoid ligaments. And this is the conus elasticus, or you would call them as the cricovocal membrane, and anteriorly it becomes thickened to form anterior cricothyroid ligament. Then there lies another ligament or membrane in between the cricoid and the tracheal rings. You call them as cricotracheal ligaments, right? Now this is the sagittal section of the larynx, and on the top you can see the, let me mark, hyoid bone, and you can see the epiglottis, and definitely this is thyroid cartilage. This is its anterior view, and this is the posterior one. This is the cricoid cartilage. Now can you see that there are two folds or ligaments are there? The superior one is the vestibular fold, and inferior one the vocal fold or vocal cord. And definitely what else you see? You see the arytenoid cartilage, and these folds are definitely present in between the arytenoid cartilage and the thyroid cartilage, right? These are basically folds of the mucous membrane in it, along with the ligaments and the muscles nearby. In this picture, you can see that epiglottis is being covered by the mucous membrane, and its edges, which are being shown in the green color, are showing its airy epiglottic folds, right? In this picture, we can see that if we strip off the mucous membrane, just outside to this, there lies a quadrate or quadrangular membrane, and you can see that it is present in between the arytenoid cartilage and the thyroid. Epiglottis is there. Its low end is forming the vestibular fold, and its upper free end is forming the airy epiglottic fold, right? Now in this picture, you can see the inlet of the larynx, in which you can visualize the green color epiglottis, and also you can observe the tubercle-like corniculate and cuneiform cartilages in the airy epiglottic folds on both sides, right? Now the relation of the epiglottis with your tongue, that you can see that epiglottis is making the median glossoepiglottic fold and the lateral glossoepiglottic folds, right? And what else we see? That we see in the cavity of the larynx, number one area is being shown, that is called as the vestibule of the larynx. That starts from the inlet of the larynx up to the vestibular fold, if you can visualize. Then the number two area is being represented by the sinus or area in between the vestibular fold and the vocal folds, right? And then you come into the third area, which is marked here, and inside it there lies the infraglottic space, which is the third space of your, or third part of your laryngeal cavity, which is just inferior to the vocal folds, right? In this green color area, which is showing a space called Rhema, glottis is present in between two vocal folds. And now in this picture, you can see the muscles posteriorly. These are the posterior cricoarytenoid, and you can see the transverse arytenoid lying transversely and the oblique arytenoid muscles lying obliquely, right? And now here, just above the lateral cricoarytenoid, the muscle which I am showing you is the thyroarytenoid, right? And above that you get the thyroepiglottis muscle, and there is another muscle named as airy epiglottis, which is just lying close to the airy epiglottic fold. And another important thing, that the hyoid bone and the epiglottis, they are being connected through hyoepiglottic ligament, right? Now in this picture, if you concentrate, let me show you that this is showing the epiglottis covered with the mucous membrane, and this is the vestibular fold, and below this is the vocal fold, and in between there is the sinus or ventricle of the larynx. And on the right side, when this mucous membrane is stripped off, you can observe the quadrangular membrane, and at the lower aspect you can find this conus elasticus, whose upper margin is forming the vocal cords. And what else you can see, that this is the cricoid cartilage, and below you get the tracheal rings, right? Now we have to concentrate the movement of action, you would say, of the intrinsic muscle. First, concentrate that if posterior cricoarytenoid is doing its movement or contracting, what it is gonna do, it has to abduct your vocal cords. You can see the line of pull and the movement of the vocal cords which are being shown as an inverted V. And how we have to learn here that if I have to make margin, that this is the intramembranous part of the Rhema glottis. And what Rhema glottis? It is the space present in between the vocal cords, you would say, and this is the intracartilaginous part of the Rhema glottis, right? So in abduction, you can see the posterior cricoarytenoid is in action, right? Now what you see here, the lateral cricoarytenoid, see the line of action, and now what is gonna do here? They are doing the adduction of the vocal cords, and you can also see that lateral cricoarytenoid along with the transverse and oblique arytenoid are supposed to do the adduction of your vocal cords, right? Look, these interarytenoid muscles, which are they? They are basically the oblique arytenoid and transverse arytenoid. They are also doing what? The adduction of the vocal cords, right? Now see the thyroarytenoid, what it is doing when it is contracting in a sense, so fibers of this muscle are approaching and causing what? They are basically trying to relax your vocal cords. Can you see the line of pull? And this is how they can relax your vocal cords, right? Now see, this is the abduction of your vocal cords, that if we are going to contract, you would say, posterior cricoarytenoid, which are your only abductor, this is how your vocal cords are being abducted, right? And if you want to show the contraction of the lateral cricoarytenoid with the transverse and oblique arytenoid, you get the adduction of the vocal cords, right? Now we have to learn about the variations in the shape of Rhema glottis, right? Now you can see that during normal respiration or resting phase, what happens? The laryngeal muscles are being relaxed and the Rhema glottis will be showing a narrow slit-like position, right? And now see, during forced respiration or with the deep breath, deep inspiration causes what? They cause your vocal ligaments to be abducted, and this is done by the posterior cricoarytenoid muscles, so causing opening of your Rhema glottis widely, right? And you can see like an inverted kite shape being shown, right? Now during phonation, phonation occurs when our vocal cords, they approach towards each other, means they are in a adducted position. So what is going to happen during phonation? Your arytenoid muscles are supposed to be adducted, and the arytenoid cartilages along with the lateral cricoarytenoid muscles, they are doing what? To do the function of adduction, right? Now a special case, whispering. What happens here? The vocal ligaments are strongly adducted, you can see that, means intramembranous part is closed or shut. But what happens? That the relaxed arytenoid muscles, they are allowing the air to pass through the intracartilaginous part of your Rhema glottis, right? And this occurs as if there is a modification of a toneless speech. So when we whisper, no tone is produced, right? So again, let me repeat that if sagittally your larynx is being cut, the uppermost area or space is called as vestibule, which is present just above the vestibular folds, you would say. And there lies the middle space called as ventricle, which is present between the two folds, that is the vestibular folds and the true vocal folds or vocal cords, right? And just below the true vocal cords, you get the infraglottic space or part of your laryngeal cavity, right? And now the specimen is being shown, and you can see that with the instrument the area being holded is the airy epiglottic fold, right? Can you see it? Now another important fossa on each side of your laryngeal inlet is the piriform fossa. This is the fossa where usually the foreign body or a fish bone is usually lodged here, right? And this is the you would say the superior aspect to show you that there lies the epiglottis and posteriorly the arytenoids, and then you can visualize the Rhema glottis being clear. You would see margin is being given by the true vocal cords, and laterally or superiorly you are observing the false vocal cords on both aspects, right? And a little bit about the vagus nerve that is going to give rise the laryngeal nerves, the recurrent laryngeal nerve, and you know that it is the motor supply to all of your intrinsic muscles of the larynx except cricothyroid, which is being supplied by the external laryngeal nerve, which is also a branch of vagus nerve. Now you can see that on the left side this recurrent laryngeal nerve is passing below the arch of aorta, and on the right side it is passing below the, you would say, subclavian artery. So keep the difference in your mind, right?